Good morning. I am with Bernard Harris and Ed Harrison of Pikes Peak Strategic Group. Good morning, gentlemen.
Good morning, Dan.
How are you?
Doing well.
That's good. Today, I want to talk a little bit about how to cut your healthcare costs now. I know that in the news, we've just been inundated with the Affordable Care Act and healthcare prices going up, health insurance, deductibles, all this stuff, and I think it's just created a lot of confusion in the market. What do you think, Ed?
Well, I think first, with the Affordable Care Act, that's going to be they're going to be enrolling again starting this fall, and no matter how we look at it, the price of overall health insurance is going up, whether it's through the Affordable Care Act or your own private insurance, whether you got Kaiser, Blue Cross, Aetna, or whatever. So if you look at the literature that's out there in the healthcare industry, there's going to be probably double-digit costs going up the 1st of January. Now, for Ameriplan, we are pretty much keeping we are not insurance. I always throw that out to people. Ameriplan discount health programs are not insurance, but we are a support to regular health plans as a discount provider. And with our healthcare programs, in particular our discount dental and health programs, we can save Americans quite a bit of money, in particular through out-of-pocket expenses. As I key in here, let's key in looking at the healthcare program first, if we can, Dan.
Sure.
A lot of our fellow Americans, like I say, will be getting information now and throughout the rest of the year on the price of regular health insurance going up. And in order to keep those premiums down, people will be opting from the insurance companies higher premiums. And higher premiums usually mean that you get, if you got higher deductibles, you can pay a lower premium. But with that being said, most Americans, as I read the literature, only have $3,000 or $4,000 in savings. We Americans really don't do a good job of saving. So I don't know very few Americans who have high deductibles, $2,000, $3,000, $4,000, even $5,000 or more in deductibles that will be able to afford their insurance. With the Ameriplan discount programs, we have our basic program, which is $49.95, takes care of the whole household. We can take care of some of those out-of-pocket expenses, Dan. In particular, lab work, CAT scans, and these sort of things that people can save money on. Because people have to realize that when you have a high deductible, even though you got a low premium, you have to meet that deductible. If that deductible is $5,000, you as the customer must come up with that $5,000 before the insurance company kicks in with their portion of the money. And that's the same, or their funding. That works also with if you got to go to the hospital and that sort of thing. So that's where our healthcare program can help our customers and support their regular insurance, whether it's through the Affordable Care Act or whether from their private insurance, which are really one and the same.
Right, exactly. And it sounds like, if somebody wanted to cut healthcare costs now, cut their out-of-pocket expenses now, the Ameriplan discount medical would be a good way to get started, even if they have insurance. What do you think, Bernard? Does that sound about right?
I totally agree with that statement from the standpoint that everybody needs to understand that they're going to have out-of-pocket expenses, and it's a fact. There's been several articles in the paper that people are taking these high deductible plans with the hope that nothing ever happens. I'm living testament that something's going to happen medically as you age, and even as a young person, you're relatively healthy, but accidents do happen, and this $49.95 is a lifesaver with regard to your savings and your livelihood. And we're talking on average $1.68 a day for the $49.95 healthcare plan that can literally help you and your entire household.
So this would be a great way to reduce out-of-pocket expenses as well. I mean,
absolutely, absolutely.
And what you said kind of strikes a chord. If something can happen, or if something can go wrong, it probably will go wrong at the worst possible time.
Yes. And one of the things that is most striking about this particular plan, the rates don't change as you travel across the country. You know, for whatever reason, your AmeriPlan benefits go with you. Unlike traditional insurance, when you leave your home area, or was it 25 or 26 miles, you go into a different category. AmeriPlan is always there for you and your household members. And I want folks to understand, I use the word household versus family. Very important distinction in how good we are in AmeriPlan.
Right. It includes entire household. So let me see if I can get something straight. Say if you do have a high deductible insurance plan, maybe you've got $5,000 or $6,000 deductible. Your monthly payments are fairly low, but your deductible is high. Will the AmeriPlan healthcare plan kick in to help you with the to work within that deductible?
Absolutely, absolutely. What's going to happen is the AmeriPlan company will work with you with AmeriDoc, and they're going to get those deductibles lowered and possibly get you in with your insurance so they can pay. A lot of folks are under the misconception, oh, okay, I've got insurance. Insurance will not pay until you've paid your deductible, period.
Right, and I've heard with the with the Affordable Care Act that if you go into the hospital with a major issue, they may want the entire deductible up front before they'll treat you. Is that something you've heard?
That's partially true. They have to, by federal law, they have to stabilize you, but they don't, and they can't ship you to another hospital. But what they will do is stabilize you, provide you care, and if your insurance doesn't kick in, they're going to get their money. Period.
Well, they have to. I mean, that's the way the system works. If you don't pay, you don't get the treatment. But still, you can get a decent discount within your deductible with the AmeriPlan, even if you have insurance.
Absolutely.
So Ed, I had a question about if you're employed and you do have a health care plan through your employer, can we still take advantage of the AmeriPlan health care plan for out-of-pocket expenses?
Yes, you can, because different employers, whether large, small, or in between, have different policies for their employees, so they could vary from company to company. And we also are, people aren't aware of the fact, the Affordable Care Act really applies to people that have 50 employees. Companies have 50 employees or more that must require or give opportunity. Those that are less than 50, they really don't have to provide any type of health insurance. So that mom and pop store operation, they are really our big customer because we can get their employees and the employee owner with our business packages that are real reasonable. But getting back to your actual question was the fact that, yes, we will complement that employer program, but we would have to sit down individually, Bernard or I or one of our associates, and talk with that employee one-on-one to see exactly what they have. Bernard and I know our team. We do not pretend to be licensed health insurance people. That's not where we go, but we do have enough experience to look at what you have and try to blend our healthcare program, in particular the 49.95 and or the dental plan that will complement your employer's uh, uh, insurance plan that he or she is providing for you. So we can work very well with the employers, large, medium, or small, but we do it on an individual basis, and our first emphasis on how can we help that employee cut those out-of-pocket expenses and still get quality service at a reasonable price.
So Bernard, Ed brought up a good point here about working with small employers to offer an AmeriPlan discount medical plan to employees. How does that work?
If they there's a certain number that they have to have before they're required to have the Affordable Care Act. But under that number, they're not required to do it because they don't have the funds to cover all those costs. The AmeriPlan Corporation has two different plans that they can look at. They can offer what we call, or I call, the traditional healthcare plan at $49.95, or we have an employer plan that offers our absolute Cadillac plan at $79.95. No, $79.99 for the employee, and then it's a little bit more for the employer, but they get everything that AmeriPlan offers. Personally, I would recommend the $49.95 healthcare because we want folks to not have to pay a lot of money and get what they need, just the healthcare. And then if you would like to, the employer can use this plan and just say, hey, I want to upgrade for my employees, and then move up, and which is perfectly feasible and available to do, working through Ed and I.
So, Ed, Bernard brought up something that's really interesting here, the dental care. Now, even if you have good insurance through an employer or other means, normally the dental insurance is not very comprehensive. It can be really expensive, and it doesn't cover much. So, what can you do for folks with the AmeriPlan dental discount plan?
Well, the dental program is our flagship program. That's the program, our dental, vision, prescription, and chiropractic program, which is included in the healthcare program. For those who take the $49.95, that's part of the package also. But with our discount dental plan, the great thing about that plan is if you have a dental issue today, I can sign you up for that program today, and you can go to the dentist today. Many of the traditional type of dental insurance, there's usually a waiting period. So if you have extensive dental care, you might have to wait 6 months to a year maybe to get a crown or some other type work. So the great thing about our discount dental plan is, once again, it can complement that employer's insurance, their basic insurance, because, like I say, many of the traditional insurance, they have caps. I know when I was working for the state government, we had a cap of $1,200 a year on the insurance there. With the AmeriPlan, we don't have that. You can go to the dentist as much as you want from day one. We also have a wonderful vision and chiropractic service also included as part of that package. And once again, as Bernard said, it's the $19.95 program for the entire household. And these days we have blended families, and sometimes mom or dad or someone's moving in because they're ill or whatever. So they would be automatically covered with our dental program. So the dental program saves a lot of money, not just on basic dental care, but also on braces, dentures, and just an array of things that we can do to, once again, complement the employee's basic insurance program.
And to cut out-of-pocket expenses.
Correct.
Now, you brought up something real interesting that I think, if you think about it, it really boggles your mind. Say if you did get dental insurance and you had a tooth problem and they delayed you for 6 months, you had to wait to get treatment. Basically what you're doing is paying the insurance company for treatment 6 months from now.
Yeah, and a lot of people don't realize that. When I hear people from time to time, and I don't put down our competitors and so forth, but they'll say, oh, I'm getting 2 free cleanings this year. No, they're not free. You're still paying that monthly premium. So by the time you get to the dentist, whether it's 6 months from now, you're really paying for that. So people many times really don't understand entirely what dental insurance is all about. And that's why weekly Bernard and I do these tapes with you, Dan, is to educate the public on what's best for them and their families. So once again, I highly recommend our discount dental program. We can save people money and also have the quality service through licensed dentists throughout the country.
And Bernard, Ed brought up a really good point here about the difference between dental insurance and the discount dental plan. The dental insurance, people think that the work that's covered is free, but it never is free. I mean, you're always paying for it. What you're trying to do is insure against the catastrophe. But
Exactly.
if you know you're going to have some expenses, then the discount dental plan might even be a better choice.
Absolutely, for several reasons. But let me go back and add to what you and Ed had said with regard to insurance. Some of the procedures you have to wait anywhere from 6, 12, 18 months. So effectively, they're building up your money to pay for the procedure that discount dental through AmeriPlan is going to give you the next day or the same day you sign up at almost 50-60% discount. So it's really, for lack of a better term, a no-brainer. And then I would say a vast majority of our providers are going to put you on a payment plan to take care of the procedure if you don't have the cash readily available. The benefits for being with us is absolutely incredible.
So no matter what you do, I mean, no matter what treatment you get, you're going to have to pay for it one way or the other, and maybe the discount dental plans would be a way to get the absolute best deal in the long run.
Exactly.
Without waiting a lot of time, because how long can you wait with bad dentures or, you know, a tooth problem? I would think that if you've got some pain or some real problems with your teeth, you want to get this fixed right away.
And to give you an example, a traditional family of 4, you're looking at about $125 a month just for the dental portion of your health care program. $125.
Now, is that insurance?
That's insurance.
Okay.
With the AmeriPlan, you're paying $19.95, which is less than almost a fifth of what you would normally pay. And then on top of that, you're going to get anywhere from 40 to 70% off on those same procedures. Again, it's a no-brainer being with AmeriPlan.
And you mentioned something about the per month per household. What is that? How does that work?
Okay, again, clearly printed on the brochure, $19.95 for an entire household. In simple terms, that means who lives at that particular address, up to and including kids that you have in college. This is a user-friendly program that has all the benefits that has been proven time and time again. In fact, above 22 years now, 22 consecutive years of proven reliability.
So I've got kind of an oddball question. Say if you do have the discount dental plan for the entire family, you've got a child in college out of state. Is he or she still covered for the dental plan?
Absolutely. Absolutely.
Really? So, Ed, we're talking about reducing out-of-pocket expenses, and if I look at the brochure, I go back to the brochure, and there's a lot of services here that are covered. You've got 80% on dental services, you've got no limits on visits or services, and then there's orthodontics, prescription and chiropractic, and I wonder if a lot of those costs people don't always tally up for the month and say, you know what, my gosh, we're spending an extra 100, 200, 300 in addition to the basic dental for everything else. And I think that the discount dental plan with all the other options here would be a great way to reduce out-of-pocket expenses.
I agree wholeheartedly, Dan. And our main emphasis, the Ameriplan Corporation, is to help save families money, one household at a time. And if that's why, once again, we emphasize the fact that we meet with you every Tuesday morning and try to educate the public on the difference between discount dental services rather than the insurance. Because still there's a number of people that just don't understand the difference. But once people are educated and they look at their budget, as you mentioned, for $19.95 for an entire household, with that kid in college that's on the East Coast or wherever, and they need toothache, they've got tooth problems or whatever, all you have to do is go to our website and find a dentist in the local area and present your Ameriplan card to them, and that tooth extraction or cleaning or a crown can be done at a considerable amount of savings. So the college student and the family are big emphasis, as well as seniors for the Ameriplan Corporation, and we're trying to do all we can to get the word out on how tremendous our company is, the Ameriplan Corporation, and their discount dental programs. You can save money. So as Bernard says, it's a no-brainer.
So Bernard, I'm looking at the brochure here, and our subject today is reducing out-of-pocket medical and dental expenses. So I'm looking at orthodontics, and I know for my child it was about $6,000 for orthodontics. Is there a way that the Ameriplan dental plan can help with the orthodontics?
Absolutely. It will. All you have to do is go to our website, find the provider that you want, go present your card, and you can get the braces for your kids. And Ameriplan does exactly the same thing for adults. Traditionally, insurance companies will not provide the braces for adults. That's usually an out-of-pocket expense. In case in point, a couple of folks at my church had to pay that out of their pocket, and I said, had you let me know, I could have saved you a lot of money.
Right. We need the big thing is education. So, is there an age limit for any of the dental services?
No age limit.
Absolutely not.
No age limit?
No age limit. From infants to adults, seniors, we service everybody.
So is there a specific issue with the seniors? Because I know that as you get older, of course, your teeth age and things start tending to fall apart, and it can get very expensive. So is the Ameriplan good for senior dental issues as well?
Yes, they are, Dan. And this is I'm glad you brought that topic up, because as people get on to their Social Security and Medicare and all those sort of things, a number of seniors believe that if they get Medicare at age 65, that dental is a part of it, but they're sadly mistaken. So we try to educate the seniors in the local area at the senior centers and other places to emphasize the fact that we can get that person who is that individual who's living at home, maybe alone, who's a senior, a 1995 program which will cover dental, vision, prescription, and chiropractic. It also covers dentures and these sort of things. And that's one of the biggest issues facing, and I can say it because I'm a baby boomer, and baby boomers had a tendency not to save a lot of money during our time. And now we're at 65. For me, I'll be 67 next month. Is the fact that we have a lot of out-of-pocket expenses, and with this discount dental program, Ameriplan USA, we can help save our our fellow baby boomers a considerable amount of out-of-pocket expenses, not just on adult braces, but on the basic cleaning and prevention that people need to do at least twice a year. I know for me, I go to the dentist at least a minimum of twice a year, and it cuts down on my expenses. So we encourage people to go to the dentist. I just was reading a stat the other day that over 100 million people last year missed their dental appointments or didn't want to go to the dentist. So we know it's not fun going to the dentist, but
No.
you need to get those basic cleanings and do the preventive work, and that way you won't have these large amounts. So seniors are a big part of our business, as well as our college-age students, whether they're living at home or away.
Well, I think we've really covered a good topic here about reducing out-of-pocket medical and dental expenses, don't you think?
So I think so, Dan.
What do you think, Bernard? Is there anything else you could add that we need to know?
Again, this is just so easy. It's user-friendly for the customers out there, our benefit members, and if they have questions, give Ed or I a call. The website will walk you right through it. Like anything else, it's very user-friendly, and we want to help people save money. We want to help, and we're easy to get to.
So what's the next step? If somebody's interested in finding out more or signing up for a program, where do we go?
Well, hey, you go to pikespeakstrategicgroup.com. You go to that website, once again, www.pikespeakstrategicgroup.com. There's also, once you go on the website, it's a friendly, easy-to-use web page. If you have questions, you can email Bernard or I or one of our associates. We have a phone number there if you'd like to contact us. But we have a lot of educational material on the website. And if there's a program like our $49.95 or our $19.95 dental program, you can sign up, and it takes no more than about 5 minutes to do that. Once you sign up, you'll get your card in 7, probably 10 business days. But you can use the dental and the healthcare programs right away, except for the hospital advocacy. You have to wait 3 days to use that. But we always like to make contact with our new members so we can educate them, assist them on how to use the program and how to go about finding a medical provider in their community.
Well, that's great information, and it's easy to sign up for, and actually you guys will even take phone calls and email questions.
That's correct.
Well, thanks. I appreciate the time today. I think we covered a lot of material, and I hope this has been useful.
Well, Dan, it's always a pleasure to be with you every Tuesday. We look forward to chatting with you next Tuesday. We wish everyone a happy holiday as the 4th of July comes up, and hope everyone's safe and enjoy the holiday with their families and friends, and drive safely.
Yes, we will. And Bernard, thanks. We appreciate the time.
Yep, and I'm going to be getting back with Mrs. Eckley up here in Woodland Park, and to me that was a big nugget, given the fact that we talked to the seniors agency folks, Ed, before you left, and it just shows you that the PPSG is out there, and here somebody 20-something miles away is calling. That is good news to me.
That is excellent news, and you'll be able to help that person as well.
Yeah, and she's a senior citizen, and she wants the dentures.
Excellent. Gentlemen, have a great day, and we
All
will
right.
talk again to you next Tuesday.
All
Okay.
right, take care.
Bye now.
Bye now.